All right, well, thanks very much, everyone, for being here. Hello and welcome to this community update presentation by Tuolumne County Public Health and the Office of Emergency Services regarding COVID-19 and our local response to it. I'm Ryan Campbell, your supervisor for the 2nd District. I'm also the director for the Office of Emergency Services for Tuolumne County. I'm so grateful that you could join us tonight via the web with all of its wonderful foibles and technical issues that always come up. I'll begin by introducing our panel. I want to introduce Dory Beets. She's our brand new OES coordinator. She's going to be the one, along with Michelle Giacchetta from Public Health, answering your questions and responding to some of the issues that come up. We'll also be talking with Dr. Sergenko. He's our Tuolumne County's Public Health Officer. We have Dr. Alex Hurd on with us from Adventist Health. Also Liz Peterson with the Tuolumne County Administrator's Office, Rebecca Espino and Steve Boyack from the Health and Human Services Agency. And we also have Supervisor David Goldenberg from District 1, who's going to be on with us. So like I said, we'll do our best to get the live question feature functioning, but we did issue a survey ahead of this meeting. And so we were able to get a significant amount of feedback from the community, which we really appreciate. And so if we're not able to get the live question feature set up, we'll be going off of the feedback received there. Okay, so I think we will go ahead and head into it. And so I'll turn it over to our OES coordinator, Dory Beets. Dory, how are you doing?
I think I'm great. Awesome.
I'm getting the wave.
Yeah. All right. Let's see. We'll do it. We're learning this system, so I apologize. Hi, everybody. Dory Beets here with Supervisor Goldenberg, and we will work through this. So thank you for everybody, for our panelists, our presenters, and of course everyone who's joining us this evening. So thank you, Supervisor Campbell.
All right. So Dr. Sergenko and Michelle, do you want to kind of give us an overview of current data, our case rate, and kind of go into some of the third-party administrator proposals being planned?
Sure, yeah, we can go ahead and do that, and I'm going to bring in Dr. Alex Hurd at the appropriate moments to talk about anything that applies to Adventist Health and Sonora Regional. And then I will apologize ahead of time. I'm wearing my scrubs because I'm covering an ER shift at 7 o'clock, so I'm going to hang up here about 6:45 and run up to the John C. Fremont, which is our critical access hospital here in Mariposa. So Dory, if you could share the slides with the folks on the program, and then we'll go from there.
You always have the best excuses for leaving early. Sorry, I'm so sorry I have to leave early, but I have to go save lives. It's a pretty good excuse you got there.
Yeah, my intent is never, you know, I'm not having to do that. So I'm hoping people are preventing injury and illness and not needing my other services. But yeah, so Dory, you're going to launch that into slideshow, and I'll just tell you next.
Oh, let's see. Hold on a second. Oh, there it goes. All right. Can you see that?
Yep, totally. All right. So Supervisor Ryan, our Supervisor Campbell already did introductions and captured a couple more people that I didn't include when I made this slide just a half hour ago. So go ahead next. And what we want to do is just kind of give a snapshot of what we look like today with COVID in the United States and in California, but most specifically Tuolumne. And right now we're looking at just over having had 3,700 cases in our residence. That includes 67 active cases that we are currently monitoring that should be in isolation or hospitalized. Of that 3,700, that does include 1,300 prison inmates. So those don't count against us in terms of metrics. And when we talk about metrics and moving from one tier to the next, what I call the guests of the state do not count against us in terms of those metrics. Unfortunately, we have had 51 deaths associated with COVID, and our case fatality rate, that is the number of cases that we have that die from COVID, is slightly higher percentage-wise than the state, but it reflects the fact that we do have an older than average community in Tuolumne, and so I'm not too surprised by that. As of yesterday afternoon, and Dr. Hurd may have a further update as of today, we had 10 hospitalized cases that are COVID cases. 5 of those are Tuolumne residents, and then you can see the distribution of patients where they're at within the hospital. The ICU is the highest level of care, and then the SDU is the step-down unit, which provides a high level of care, but not as tightly monitored as the ICU. And then the medical surge is what you think of as a typical hospital bed. And then we do have one obstetrics patient, at least as of yesterday, that was COVID positive. Next. So this is our dashboard, and you can look at this at any point in time, and it's referenced up there. But also, if you just go into any search engine and type in Tuolumne County COVID dashboard, you can pull this information up, and we update it on a daily basis. We get the update out at about 4 o'clock in the afternoon. That'll give you the latest and greatest information. The cases by date of report here, what we did is we did take off the cumulative, which is a much bigger. This is just day by day how many cases we're seeing. And we are at the point where we've come off of our holiday surge, and we're having anywhere from 8 to 20 cases to 30 cases in a day. And realistically, what we need to do is see that drop. But what is encouraging is that has been dropping since the holidays. A week ago, our case rate was about 21 cases per 100,000 per day, and we're now dropping down to 15, as you see in that corner there. And our test positivity is about 5.8%. So next. So again, numbers are coming down gradually, and what I'd like to do is show that in comparison to our adjacent counties. And it has been mentioned at the board meetings previously, Tuolumne County is in partnership with 4 gateway counties to Yosemite National Park, Madera, Mariposa, Mono, and Tuolumne, along with the park itself. And so we share an epidemiology surveillance unit that I work with that develops these charts. We are the light blue line. And as you can see, we are gradually coming down and having the second lowest case rate after Mariposa County. But nicely, all of these are coming down. What we saw, again, these peaks right in here, that's your holiday surge coming about a week and a half after Christmas and New Year's gatherings. Because people are, basically back at work, not traveling as much, we know that cases are directly correlated with population mobility. So the more people that are traveling, the more we'll see cases. So my concern right now is we're doing great, but if we see increased population mobility with the lifting of the regional stay-at-home order, we may see over the next week or two an uptick in cases. I am hopeful that all of us here that are listening and are fellow residents in the foothill communities in Tuolumne, Mariposa, etc., continue those good things that reduce transmission, wearing a mask, washing your hands, watching your distance, etc. And we can keep this as flat or going down further. Next. So as I mentioned, every week we get a tier assignment from the state based upon 2 metrics. One is our case rate, which is the average number of cases per day per 100,000 population. So that per 100,000 allows us to be compared with other counties. It kind of standardizes that measure. The other thing that we look at is the positivity rate, which is the number of tests that are taken that are positive. And the metric we need to cross, the line we need to cross here to get into the red tier, is 2 weeks in a row where our case rate is 7 new cases or less per 100,000 per day. And actually, we're really happy with our positivity rate. Next, I think that is the next chart, is that, as you can see here, that less than 7 gets us moving from the purple into the red. And then when we get into red, we have to be in any tier for 3 weeks with improving metrics. And then we can move down into the orange tier. And again, right now we're kind of sitting on a cusp here for test positivity between purple and red. So we need that to go down a little bit. And what we encourage, as always, is for people to get tested, even if you're doing it for what we call prevalence purposes, making sure that you're not positive. That contributes to our denominator and brings down our percentages, but still reflects the burden of disease in the community. Next. So I'm going to talk a little bit about vaccinations, and I may have Shelley Giacchetta talk a little bit more about this because she is more intimately involved in the vaccination planning. And the other thing is I may bring Dr. Hurd in to talk a little bit about what Adventist Health is doing. So the big change that has happened from about a month ago to now is that we really had a fairly elaborate plan of moving through various phases, from phase 1A being our healthcare workers and the residents of both our skilled nursing facilities and other long-term care facilities like residential care for the elderly, through 1B, which was other critical infrastructure, into 1C, and so on. And what has happened is sort of a change in strategy for 8 of the United States after having a conversation with then Secretary of the U.S. Health and Human Services, Alex Azar, is we move from a sector-based approach to an age-based approach. So right now what we're doing is phase 1A, we're pretty much done with that. That is, again, our healthcare workers and long-term care residents. And we're working on 1B. And 1B is individuals who are 65 and older. And then these 3 sectors, education and childcare. And I will say that includes informal childcare, emergency services, which is predominantly our law enforcement, but also emergency management, and then food and agriculture. And food and agriculture is everything from the site of production, like a turkey farm or a cattle ranch, all the way to servers in restaurants. And so as supplies are allowing, we're moving through these groups. We've been directed by the state to move through these groups equally. That is, there's no leaning towards one age or age over a sector. So we're trying to spread that equally. And what I will say is, in terms of ages, what we are doing is working kind of backwards from the oldest to the youngest, and we'll talk a little bit about that more in a bit. But once we get done with phase 1A and phase 1B, unless we get further guidance from the state, we will be moving strictly into a age-based approach. And as we know, or as I'll share, is realistically the most likely predictor of a bad outcome from COVID is your age, independent of any underlying medical conditions or occupation. We really know that age is the closest thing related to whether or not you'll end up in the ICU or end up dying from COVID. Next. So currently, this is what we've done in public health. Is we have delivered just over 4,000 vaccines, and that represents just over 3,500 individuals vaccinated. So that includes both first and second doses for that larger number. And we'll be continuing to work through our allotments. And what we are finding is that we are truly bumping up against what our supplies are. And I think that's probably the most important thing I can message in regards to vaccination, is that the manufacturers, Moderna and Pfizer, can only crank out so many vaccines per week, per month. And that goes into a central location with the feds, and then it's distributed to the states. And on average, California has been receiving around 600,000 doses per week. And that really works out to about 1,000 doses for Tuolumne per week. So as long as we're, again, we're getting that, we're getting kind of a per capita basis. We get a little bit more. We've gotten a little bit more because initially the allotment was based upon our percentage of our workforce that was in healthcare, and we've shifted to what our proportion of 65 and older are. And so that's given us a little bit more vaccine, and we're working with that. Next. So when we talk about the vaccines, we've got two vaccines that we're working with. One is the Pfizer vaccine and the other is the Moderna. They are both what are called mRNA vaccines. And realistically, not that much difference with them in terms of either safety or side effect profile. There is a third vaccine that will be going through the emergency use authorization process over the next month or so. That is the Johnson & Johnson or J&J vaccine. And the nice thing about the Johnson & Johnson vaccine is, as compared to the Pfizer and Moderna vaccine, it is a single dose. The Pfizer and Moderna vaccines require either a dose 21 days apart or 28 days apart, depending upon the vaccine, whereas the Johnson & Johnson is a one and done. The downside of the Johnson & Johnson is that it is a little less effective in terms of preventing disease, but equal in preventing serious outcomes. So we're waiting it to go through the approval process. And at the end of the approval process, the Advisory Committee on Immunization Practices, or ACIP, of the Centers for Disease Control and Prevention looks at that vaccine and looks at how it would best fit into the management of COVID. And what I'm going to guess is one of the recommendations, maybe this may be the vaccine that we put into younger people, knowing that it's less protective but prevents serious outcomes. So as I mentioned on the previous slide, we're moving through 1A and into 1B, and we've got multiple places that are doing vaccination, including Adventist Health and Public Health. Next. So currently, Public Health is continuing to do what are called closed points of dispensing, and that is where you have registered for or expressed interest, filled out the interest form for us, and then we will set up an appointment for you when we get to the right age. So what we're doing right now, we're in phase 1A, and then we're doing those who are 70 and older, and we're looking at the education sector. We've pretty much wrapped up public safety, our emergency services, and then we're also exploring how we can do the food and ag sector. So more to follow on that. We're planning on our second doses, points of dispensing for those, and then we'll continue doing first doses as we have that vaccine availability. And again, this really is long-term because receiving about 1,000 doses a week is that will take us well through this summer. So we're hoping for increased doses, but again, that depends upon greater manufacturing. Adventist Health, I don't know, Alex, you want to speak to this?
Sure. First, I have to unmute myself. First of all, it's great to be part of the vaccination effort because it's the first time that we're actually doing something about COVID rather than just reacting to it. And I would just like to thank the County Public Health and all the community volunteers who have helped us. From an Adventist health system, in addition to the 4,000 plus that the county's given, we've given 3,800 first dose vaccines. We're doing the weekend clinics at the fairgrounds, and we'll continue on that process. As some of you may have heard or experienced, we had an unfortunate issue with our webpage last weekend in as we expanded down to a lower age group of 65 and over, we got overwhelmed with requests. What I'll tell you is the folks who had an appointment rescheduled, you will be getting a call probably next week to get you in there to schedule you for probably the weekend of the 20th and 21st. So what I just want to encourage everybody is to focus on the fact that this is a marathon. As Dr. Surjenko said, it's going to take a while to distribute it to all the folks in the community. But the good news is we've almost finished the over 75 group. We're on to the next group, and then we'll get on to the next group, and we'll get on to the next group. So we're committed to having lots of folks be able to put these vaccines into arms as soon as we get them. And, I just want everyone to sort of stay loose and stay patient.
And thanks, Doctor. You and Dr. Surjenko kind of figured out what the first question I was going to ask was related to. One of the questions on the survey, obviously there's a lot of frustration in the community, a lot of people very eager to get vaccines, to kind of get past this terrible pandemic and on all of the effects that it's having on the community. And one of the questions that kind of came up a number of times was related to that there's not really one central place where people go to get a vaccination or to get information about vaccines. And I think there was a desire to see how is Tuolumne County Public Health coordinating with local healthcare providers like Adventist and with our tribal clinics. And you went over that a little bit, but if you could kind of expand on that, how do we all work together?
So I think, I got to give a shout out to Alex as he came on as chief medical officer right in the middle of the start of the pandemic. And, at that point in time, I was doing my first stint as interim health officer. And we were able to initially meet in March of last year. And we've had an ongoing relationship, in between our infection control practitioners and our communicable disease nurses, between our providers and me as the health officer. And then in this latest iteration, how do we get vaccines out most effectively to our residents and to the patients of Adventist Health? And so sometimes it means us sharing vaccines with Adventists so that they can catch up on their population. It's where they're helping us out getting our public safety workers vaccinated because we don't have that bandwidth to do it. It really has been an exceptional partnership. I will say that going back to the start of this is they were able to, one of the first testing platforms in the region, they got the BD Max into their lab, and that helped us out tremendously. So that's an ongoing partnership. I won't say that it hasn't had hiccups, but the phrase that I think I've used way too many, it's the first time we've been through a pandemic together, and we are learning this, but I think our relationship is incredibly strong. Alex, additional thoughts?
Yeah, I would just say that we have on our daily incident command for the hospital, we include Michelle Giacchetta or Dory Beats. They show up. We have a weekly call with both the two Miwok and MACT and County Public Health and Adventist Health. We have a meeting to discuss vaccines and what we can do in the next coming week, and we sort of talk strategy. I think what is very fair to say from the public perception is it's hard to see that single place because we all have different platforms, different systems, and different reporting requirements to state, federal guidelines. What I will encourage everyone to know is that we are working well together. And so again, we're going to get there and we'll refine the process each week. We get better and better and better.
Yeah, and I'll follow on that. It is frustrating because we have, each of us has a different, Adventist has a sign up for their vaccines. We have a sign up for our vaccines. The state will eventually have a platform called My Turn that you could actually go to right now, but is not active yet for any counties other than San Francisco, Los Angeles, and San Diego. And that's something we actually have to figure out in the next 20 days is how we as a county will implement this program called My Turn that will serve as a single point of sign up, but may create again some more hiccups in how we get people scheduled for appointments for vaccination. So definitely more to follow on that as we learn more from the state. This is a relatively new thing over the last 10 days. And the other thing I'll throw out there just for people's awareness is, and we mentioned this at the board last week, was a third-party administrator. That is, Blue Shield will be supporting the state in distributing vaccines, but also doing data analysis and data collection. And so that's we're seeing how that works out. We're ensuring as a county, and I'm sure that Adventist as well is working with their partnerships to ensure that we continue to get a smooth flow and steady number of vaccines so that we can continue to do the great work we're doing in getting vaccines into people's arms.
And on that note, doctors, there was another question that came up a number of times among the public, and forgive me, I'll kind of paraphrase several of these questions. It's essentially, why are we getting such a small number of vaccines? In fact, there were some folks that were asking, it seems like we're getting fewer vaccines than other counties are getting. Why aren't we getting more vaccines when we have a higher average? The age of our population is higher than it is on average for the rest of the state. Can you give kind of an idea of that? I mean,
Yeah,
first, are we getting our fair share of the number of vaccines? I don't think we are, but I would want 100% of our community to have it available. So,
yeah, so I think that's the question is are we getting an equitable share and are we getting an equal share? And I can certainly say we're getting an equal share. That is, if we took the population of Tuolumne County and divided it by the total population of California, that should be the percentage of vaccines we get. The sad fact is we get 600,000 vaccines into the state per week on a good week, and we actually don't know. This is actually the most frustrating thing for me. Okay, amongst the most frustrating things is we don't know more than a week in advance how many vaccines we're going to be getting. And I think probably Alex and the Adventist is in the same boat. Is there, the lead time we get is absent. We did hear from Erica Pond, who's the state epidemiologist, is that they anticipate this week getting 1 million doses to the state, which is a huge bump, and then 1.2 million for the next 2 following weeks. But that's to account for those second doses that need to start going into people's arms. So it doesn't necessarily directly correlate with a huge number of people that we're able to offer vaccines, but it will ensure that we can give those first doses as first doses and be able to use that second second part of that 1.2 million as second doses into people's arms. You're muted, Alex.
I think Dr. Hurd.
You're sending something really intelligent.
I did again. Welcome to telehealth. But from an Adventist system, we get a request for allocation from a multi-county entity. So it's almost a different pipeline than what the county alone gets. I would strongly agree that lack of lead time causes a lot of the perception of confusion because when we get the vaccine on a Thursday, we have 48 hours to get a clinic up and running for Saturday. We don't want to sit around and hold that for 8 days before we give it out. So that does give some of that appearance of confusion. What I think when the third-party administrator gets their feet on the ground, they will have a better plan to at least give us some transparency of when we're going to get vaccine. And I would just say more to come in the future as we get there.
Okay, thank you.
All right. right, I think I've got a couple more slides. I don't know if they add anything else, but we can throw them back up, Dory, if they're.
Yep.
And if you can't, that's fine too. I will.
Can you see that?
Not yet. So that actually, we'll just say that was the last slide and say it was a good job. And I think you can say, Supervisor Campbell, any more questions that you've got there, and we can just delve into those. And you're muted again.
You're muted now. It's infectious.
Seems like everything is these days.
Yeah.
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 So one of the questions that came up, and it was kind of along the lines of, I think where you're headed, talking about, we have a lot of people with underlying health conditions, and just kind of the methodology of vaccinating older people first. That came up quite a bit. You kind of went over that a little bit. Do you see that? I mean, are we basically going to start with the oldest citizens and then go all the way down until we have school-aged vaccinations? How does that work?
Yeah, I think that's going to be the general approach. And the one thing we've not seen from the state yet, but have heard that may be coming out, is some guidance on how to incorporate underlying medical conditions. We do know that age is, again, the best predictor of poor outcome, but there's about 10 conditions that are associated with a higher risk of, an ICU stay or a hospital stay. And those are very narrow definitions, like someone who has chronic kidney disease who is on dialysis, someone who has a home oxygen requirement because they have chronic obstructive pulmonary disease. So it'll be that narrowly defined, and I think that's what the state's really looking at, is the epidemiology of those disease processes and see who would benefit most, rather than just an age criteria. The one thing I will say is you'd mentioned school-aged, and right now both of the vaccines that are out there, the Pfizer and Moderna, have only been approved for people that are 18 years or older. And so, except for those high school seniors, we probably won't be getting into the school age population at all, at least as far as K through 12. I will say they're looking, go ahead.
Oh, and that was kind of a follow-up question as well. I had 3 or 4 questions that were, when will schools be vaccinated? When will teachers be vaccinated? Basically, and I'm making the assumption that the question they're wanting to get at is, when will schools be open? When we have teachers vaccinated, students vaccinated, and schools be open on a regular schedule?
All right. So I'm going to say that we're doing education right now, and coordinating that with Kathy Parker, who.
Yeah, and I think the majority of Tuolumne County teachers have received the vaccine. Is that correct?
I don't know if it's the majority, but I will say all of them have been offered, and in terms of uptake. And that's kind of, again, another thing that we can work more on is getting over any concerns that people have about vaccines and increase the uptake of people. And but I will say that I was able to attend one of the mass vaccination clinics that we did do for educators and had a really great turnout. So that gets to the second question of, when can we open schools? We've already been told it's not vaccine dependent, and I believe that. One of my things with education is we know the risk of transmission within the schools itself, especially for TK through 6th grade, is incredibly low. You're probably actually safer in an elementary school than you are out in the community. As you get older, students, as you get into the, what we used to think of as middle school, but now, the 6th through 8th grade, And then into high school, 9 through 12, those start having more characteristics like adults. And then once we get into college age kids, and especially that the biggest spreaders are the 18 to 40 somethings. And the people that actually have the impact most from COVID are those old people that are older than 75. So, there's some. So getting back to schools and schools being opened, our at-risk population is not the students, it's the teachers. So if we can protect the teachers with vaccines, protect them with other things like personal protective equipment, maintaining social distancing, things like that, then we can transition into fully open schools. Our schools, we have 12 different school districts. They all have their own respective boards, parents, etc. So we've been working through the county school superintendent with the individual superintendents on their plans. They've all resubmitted safety plans for their schools, and some schools are already back in full-time attendance. Other schools are in a hybrid mode, but there is at least some attendance of school in person by students throughout the county. So more to follow, but the question will be is, again, for high schools when they transition from a hybrid model into a full attendance model.
All right, well, thank you. And were we trying to get some more slides up?
No, I think we're done with slides.
Oh,
I think the last slide was the question slide, which has our, health@tuolumnecounty.ca.gov. We can put that. I guess we can't see the chat. And then our phone numbers, but I think Dory may be doing that.
There we go.
There we go. So again, if you can't get your question in because we've been technologically challenged, you've got our phone number, you've got our email. Please feel free to email. We do encourage people. The last bullet there is, again, continue to test. And again, the Optum server LHI site at the fairgrounds is free to you. And I've seen fairly consistently turnaround times are less than 72 hours from the time you get the sample collected.
Yes, and that's been my experience as well. I get tested on a regular basis, and I think it's the quickest it's been is about a day and a half, but usually about 2 days, 2.5 days seems to be pretty reliable. Okay, well, hey, thanks very much, Dr. Surjenko, Dr. Hurd. Hope you'll stick around as long as you can, but we'll turn it over to Rebecca Spino and Steve Boyack with Health and Human Services Agency. Hi, Rebecca, are you there?
I am Supervisor Campbell, but I believe Michelle wanted to speak really briefly about the inquiry.
Yeah. Can you guys hear Rebecca okay? Or should you get closer? You can hear her okay. Yeah, I did. I just wanted to talk a bit because I know there were some questions about when people get onto the county list or submit their information to the vaccine inquiry form, which can be found on our website. And if you have trouble or you need help getting onto that list or you don't have internet, you can give us a call at 533-7440 and we will walk you through that and put you on the list, do that for you. And a lot of people want to know why they haven't heard. And so at the top of the inquiry form says, submit your information. It doesn't register you for an appointment. It just provides your information to us so that we can contact you when it's your turn. And so we just wanted to remind everyone that we do get your name and all of your information. And as we go through the groups, we will pull your name and information there and contact you. We don't necessarily contact you right then, and it might not be the next day and it might not be the next week, but be assured that we have your information and we will let you know. So I know that can be confusing, like, well, did my name go through, and so if you put your name in there and you push go, or we do that for you, we've got your info and we'll contact you when it's your turn. And again, as we've been saying, with the My Turn system, we're not exactly sure what that's going to look like yet, but do know that we have your information and we will we'll contact you when it's your turn. So just wanted to clarify that yeah.
Okay.
Um,
Thanks very much. And I wanted to talk to Rebecca and Steve about the education and compliance element of this. But before I do that, I did kind of want to look at, since we still have our two doctors on the line, if, for example, there's a lot of misinformation, or let's say there's a lack of information out there actually about whether, if I've been infected with COVID-19 and recovered, if I've received the vaccine, do I still need to wear a mask? Is it still important to observe some of these social distancing guidelines that have been in place? What's your take kind of on that?
So the answer is yes. And I think realistically, the big worry right now is these variants that are coming out of the United Kingdom, out of South Africa, and out of Brazil, and happening other places. You know, viruses mutate, it's what they do. And we don't know what sort of natural protection you get from an infection, or what protection you have from a vaccine. If it's we know a vaccine and we know natural protection is 100%, but by adding on those layers of wearing a mask and maintaining social distancing, that increases your, reduces your likelihood of getting sick again. We do know reinfections do occur. But I will say that we know that you'll get adequate protection from a natural infection or a vaccination, that you won't need to quarantine if you are a close contact. And that's a recent change. The CDC came out with that today. And so if you've got your 2 doses of vaccine and you're 14 days out from that second vaccine, in less than 90 days since you had it, you'd be excluded from quarantines. That, I think, is a Benny for a vaccine that we had not had before today.
And I'll just add to that it's hard to compare efficacy during the pandemic. But if we look at our influenza rates for the year, historically by this time of the year, we've had probably 300 to 400 cases of influenza in our community. This year we've had 7. So the masking is probably working, the hand hygiene, the social distancing. So just keep everybody safe, keep yourself safe. If your own personal choice is not to do it for you, do it for your grandmother.
And
protect each other. Yep.
And I have to sign off now. So everyone out there, stay safe, and continue doing those things you do to reduce transmission. And we'll talk later.
Thanks very much, Doctor. Okay, so we'll go over to Rebecca Spino with Health and Human Services. How are you doing, Rebecca?
Doing good, Supervisor Campbell, and good evening, everybody, and thank you for joining us this evening. My name is, as Supervisor Campbell said, Rebecca Spino, Health and Human Services Agency Director. This portion of the presentation is really just a short overview of our modified Education and Compliance Division. The efforts at the local level always focus on supporting our businesses and to provide them guidance and assistance to safely either open or reopen or remain open. There are many businesses who are really following the guidelines, and there are some that are struggling, and that has caused a lot of concern in our community. But it's important for our community to know that the state funded a state COVID enforcement agency. Unfortunately, that funding did not filter down to our local police department or to our local sheriff. So the compliance portion of this division really had to rely on visiting businesses, writing letters, and sending referrals to our state enforcement agencies. Fortunately, during the last 2 weeks, the number of complaints have drastically declined, and the compliance rate of our businesses are also improving. But we also want to make sure the community knows is that those state enforcement agencies are becoming very active. During actually since January 1st, we've had 45 businesses that have been contacted by a state enforcement agency. So we know that there is concerns, about enforcement. but your concerns are not going unheard. Folks are coming out, folks are checking on these businesses, and we really, really encourage the public to continue to contact us at our public health phone number at 533-7440 or email us at health@tuolumnecounty.ca.gov. And again, we will continue to work with our businesses. It's only to our benefit that our businesses thrive, and also, to our benefit that our community stays safe. So please continue to contact us if you need to. We will respond.
And thanks a lot, Rebecca. I just kind of, since we're on this subject, Supervisor Goldenberg, you represent District 1, which includes the city of Sonora, where a lot of our downtown business community exists. Do you have any other questions or questions that you're hearing from your constituents or people that when you're out talking, the concerns that you hear?
Yep.
So, yeah, thank you, Supervisor Campbell. The main concern, obviously is that we're getting really close to being able to get to the ridge here. And so, if everybody works together and we, keep that cooperation going. So there's, obviously there's been a lot of concerns about the businesses, and that has contributed to the spread. That the gatherings are a huge component here that's created the problem. So the more we can work together and do that and do it consistently, combined with our vaccinations coming in, increasing those vaccinations, we have this opportunity to get to the red, and getting to the red is huge, because that's going to help our businesses tremendously. It opens up a lot more doors and allows them to do things that we just certainly can't do now. So that's what I'm hearing, a lot of that, from the people out there, and we've just got this opportunity, so let's take advantage of it.
Yeah, I agree. Okay, let's see here. So Dory and Liz, do you want to talk a little bit about our volunteer program and how that's working out?
Yeah, I'm going to let Liz talk about it, and then I'm going to pull up our website there, Liz. I'll share it here.
Awesome. Yeah, so we are looking for people who want to help. We have actually a handful of different volunteer opportunities for our COVID response. Primarily, as you heard, we need some help actually at the points of distribution, or the pods we call them, or the vaccine clinics, as you might commonly know them by. So we need actually a lot of non-medical help. We need people to, direct traffic and do sort of some patient intake or data entry type stuff. Or even people to just help set up and take down. Our public health staff, they have to do what they have to do. And so having additional help with just set up and take down would be really helpful. We also are accepting volunteers for medical, in a medical capacity, who can actually distribute the vaccine. And then we are also looking for volunteers for people who want to help staff our COVID information line. We have had that phone number, the 533-7440, up for many, many months now. And it takes a lot of dedication to sit there, answer the calls from the public. I know from firsthand experience that call line is very helpful for people, but we need people who are willing to help us. And we have public health staff who provide a great list of questions and answers, and they're there to help guide with other answers. So you're not left out on your own. But so we're looking for help in that capacity in those three areas right now. So if you want to help or can help, or want to know more, we have our website set up here on our county website, and you can go to tuolumnecounty.ca.gov/volunteer. And that will take you to this page that you can see here. And there's a registration process where you register actually through the state's program. It's a disaster healthcare volunteer program, even though you're not necessarily a health volunteer, but that's how you register. And then you fill out a couple forms that we have here. You bring those with you. Once you're contacted from public health, they'll contact you and schedule times for you to assist, either at the pods or at the call-in line. You bring those forms with you, and yeah, we'd love to have your help. If you have any additional questions, you can email us there at volunteer@co.tuolumne.ca.us, or you can give us a call at 533-6394 if you need some more information. One item of note here on our website, just want to encourage folks. We have some really eager people who want to help, and they just show up on our vaccine days, and that's not super helpful. We have to have some of these forms completed ahead of time. We tried to make the process not very difficult, but there are some things that we need to have taken care of before folks can just show up to volunteer. So please don't self-deploy. We will contact you if you want to help us, because we want the help. So we will definitely make sure we contact you. So please share this information with your friends, neighbors, family. We'd love to have the help.
And so, what are some of what are some of like the safety procedures in place? What's the training that volunteers receive to do their job safely and contribute to the community?
Well, it depends on the task. There is a yeah, I mean, that's the short answer. If they are helping with the community information,
so they receive PPE and they receive PPE and then training and that type of thing, correct?
That's right. Yes. Yeah. So we will not throw anybody in. We will make sure that they are, yeah, that they definitely understand what's being expected of them and what we'd like them to do.
I would say for the vaccination clinics, there is a pod training that the staff go through, both clinical staff who have a different kind of training, who will be administering vaccines and doing medical clinical stuff, and the support staff have another training that they go through. So as Liz mentioned, there would be just-in-time training or whatever appropriate training is necessary before they're deployed into the field or into a hole.
So a question that I got, and there's actually 3 or 4 different questions, so I'm going to cram them all together, it's basically, is there a way for the community to know where these positive cases are originating from? Is it Walmart? Is it senior homes? Is it restaurants and bars? I also had another person ask about, there was a moderate outbreak of COVID at the jail. Do we know where the clusters are happening? What businesses are testing positive, and what are we doing about it, essentially? And I'll just kind of throw that out to anyone that might want to answer.
Well, since Dr. Zerchenko had to leave, do you want to
see Dr. Hurd with his hand up.
Has trained his hand.
So, yeah, I'd be happy to, and my data is strictly from the many outbreaks that I know of from the hospital, so I don't know of any businesses which have done it, but it is almost always a group gathering, especially revolving around shared food. So it's when you let your guard down and you take your mask off and then you're eating food with other people, that's where most of that we've seen. We have outbreaks after Halloween, after Thanksgiving, after the holidays, at the end of the year. What we'll see after the Super Bowl, we'll see. But community gatherings of large people where you're not following the PPE guidelines.
Yeah, and that's absolutely true in Tuolumne County. I just remember seeing our numbers spike after, as you said, first after Halloween and then again after Thanksgiving. And a question that the community raises very often, it's something I hear very often, is why are we allowing Walmart to stay open? There's so much emphasis placed on restaurants. and in the state guidelines that's coming down to the county. Is that kind of where that originates from? It's the fact that it tends to be these communal gatherings where you're sharing food.
That
tends
does
to loom larger than grocery stores.
It does tend to follow that track, and I think that's why most of the focus is on those settings. The other piece is the length of time that you're in the environment. And what we see with restaurants is you come, you sit down, you enjoy your meal, and that's a longer trip than running in and out of Walmart. And there's a time dose relation to how long you're in an environment and how likely you are to contract COVID, and they're related.
Yeah.
Yeah, Supervisor Campbell, is it okay if I just add a couple of little things?
Yeah, of course.
To your question. Also, when you first started asking, is it this or that or the other thing, I wanted you to say yes. So we see a lot of those things. We see households, so there might be like, mom or dad gets it from work and then they share it amongst themselves. So there's household clusters, there's workplace clusters, and often, the staff might be really careful around their clients or their customers, and then their guard comes down a little bit when they have a break time and they're with each other. And as Dr. Hurd mentioned, maybe they take their mask off and have lunch together. And so then we have workplace clusters. And the last thing that you mentioned is what's being done about it. And I did just want to mention that our team works really, really hard. We have an epidemiology team, an infection prevention team, our case investigation and contact tracing team. There's a whole slew of people that work really closely when we've identified an outbreak, that work with the agency or the facility or the workplace to help contain that, which will include isolating cases, identifying cases, getting folks tested, quarantine, so to prevent that spread. And that works really well. And then so we do respond to that right away when it looks like there's an outbreak happening.
Yeah. Okay, well, I think it looks like we're about at the end of our time. We answered as many questions as we could in the time, but I understand that there are probably a lot of people out there that have additional information they're looking for. Dory, is there a way people can communicate with Public Health or Office of Emergency Services after this meeting?
Yes, absolutely. So we are going to put together some of the results from the survey, both on our webpage, as well as we will do a link with Public Health. We will both then shoot out additional surveys for folks to add questions based on tonight's presentation, simply because we couldn't get the Q&A to work, and I apologize for that. So we will figure out a way to take people's individuals' additional questions, but also show some of those questions and those trends from our original survey prior tonight. So look for that on Tuolumne County Office of Emergency Services webpage, as well as Tuolumne County Public Health. We'll post it both there, and then we'll also shoot out to those that have social media access, but we'll put it in both places. So you can send direct questions to the information, or also to Public Health or to OES here. So thank you.
All right, thank you very much. Any other questions from the panel? Supervisor Goldenberg, Dr. Hurd, Rebecca, anyone have any additional thoughts? Okay, we'll end it right there. Thank you all very much for your taking the time to be with us. Thank you, those watching at home. Really appreciate it. It's being informed and being a part of this community effort to fight this horrible scourge on our county. It's going to take the whole community, and so staying informed, staying engaged, it's a big first step to do that. So with that, we'll end. Thanks all very much. Stay safe and have a great rest of your week.
Thank you.
Thank you.
Yes, thank you very much for all the presenters.
Yeah. Yeah, thank you, Doctor, and thanks, Liz and Rebecca and Steve and Michelle.